My name is Beck Everson. I am RN BSN at Providence Sacred Heart Medical Center, and I'm a graduate of the Project Lead the Way Biomedical Sciences program at Meade High School. Project Lead the Way kind of incorporated activities and going out into the community and learning about different aspects of the medical field and STEM. So I kind of just want to do something more interactive than just kind of sit down. I liked having labs, like I always enjoyed that about my science classes and all that, and I just really liked to apply what I learned into like projects and stuff like that and working with other people. I started volunteering at Sacred Heart, and I got to see what a nurse did, and I never saw a doctor. So I was like, I want to be involved with people. I want to help people. Like, I don't want to be behind the curtain. I want to be there, like, helping people through their sickness and teaching people about how to get better and stuff like that. So I kind of picked nursing, honestly, through volunteering at the hospital and that, and working with Project Lead the Way with other nurses that came into the classroom. A typical day for me looks like I get to work at around 11 p.m. and from there I receive report, or I get my patients from my boss, and then I receive report from the previous nurse. And then I go around and check on all my patients, make sure they're good, and then I go sit down at the computer and kind of get like a good history on them, a summary of why they're here, what they've gone through in the past, things to look out for, things to assess when I'm in the room. And then I'll also correlate with our certified nursing assistants who do cares on the floor and vitals and stuff like that. And I'll give them some vitals to do, and then some of the critical patients, I'll take the vitals because I really want to make sure they're really well taken and, they're assessed right. And then after I go room to room, I usually have about 5 patients, sometimes 4, on a good day 4. And then after I do each of their assessments, sometimes I pass meds. I do a lot of IV antibiotics at night. So I hang IV meds. I work with IV therapy, which they come in and start a lot of IVs. My whole night is pretty much interacting with my patients. If I'm not charting at my desk, I'm usually at the bedside, either giving pain medication or just sitting with them because there's not a lot of visitation right now, so they don't get a lot of family, especially at night. So they rely on us to kind of be there for them when they don't have people at the bedside. Some of the most commonly used traits I find at work that I use are empathy. A lot of times I just have to put myself in their shoes, I've never had cancer. I work on the oncology unit, so you have to know, I don't know, so that's part of the hardest part. And the family comes in and sometimes they don't know what happened the previous day, so you have to be able to balance back and forth. So just you have to be very diverse and flexible and take time to really talk to people and be patient. Just have a lot of caring attitude towards people and want to help and be there at their side. The demand for nursing right now is crazy. You can work anywhere, you can do anything pretty much. You can travel to Hawaii and work in Hawaii. You can do whatever you want. You can get a job pretty much anywhere. What I appreciate from Project Lead the Way probably the most was having a career that I really actually enjoy. I couldn't imagine going to work and hating my job. That's a lot of time, I spend 32 hours a week, which isn't as much as most people, but that's a lot of time in something that you would have to love. So I'm really thankful that I found something that has made me happy, and I do get to help people. I love how much I walk at night. I love how active my job is. I get home and I'm tired. I just want to go to bed. I love that part of it. I love working with other people. The collaboration on the floor is great. Just always having someone to grab, and they don't question you. They just come and help you and, really just be there for you, even because they know people are sick, and that's the point of being there, is helping people. So it's just the teamwork is great. I really like that part of it.